Hazara Welfare, with its center in the USA and a subsidiary organization in Abbottabad, Pakistan, ardently believe in lending a helping hand to others in whatever manner possible within the means at their disposal. Please visit www.hazarawelfare.org for more on the organization. While Hazara Welfare was still busy planning, there came the first challenge, one they could have never foreseen. The enormous floods in Pakistan during the monsoon season of 2010 that left in its wake a dreadful scenario with millions homeless. Vast tracts of arable land laid waste and the humanity stunned. It was a heart-rending sight. How would these people find their feet? What could they do? What could all the philanthropists of the world do? None was aware of the scale of the task ahead. Like many others of Hazara Welfare, just go to work. The initial 2 days effort of the organization should inform the planners and the analysts as what it takes to help. The Hazara Welfare planned a medical assistance camp in the remote region of Pattan, a small town in the northern areas of Pakistan. The first step was acquiring the needed supplies, which had been done by our team and the volunteers.
Assalamualaikum viewers. Today we are arranging a free medical tour in the Pattan, and as you have seen on our website, and it has been arranged by the Hazara Welfare. And as you might have seen on our website, that we have previously arranged a very good and successful medical tour to Alvi, and now it is the same continuation of that chain. And today we will be going to arrange this tour to Pattan, and this will be you will see it is just because of your quite heartful donations and your contributions. Just because of that, today we have been able to make it out, and we will be keep on updating you regarding this tour. And this is totally free, and we are having more than 20 doctors and completely free medicines, and we will be going to provide these medicines to the poor people and helpless people over there. And it is just because of this very heartful donations of complete Hazara society. Thank you.
Day 1 began with loading equipment and supplies onto the vehicles and rendezvous with the team of doctors from Abbottabad Medical Association, Ayub Medical Complex and Park Irish Rehabilitation Centre. Team comprised 15 doctors and 2 lady doctors. It included a number of professors, senior doctors and specialists, in addition to the young doctors and nursing staff and helpers. The journey began. A long road lay ahead. Whatever was observed en route to the planned destination was in no way encouraging. At 6:30 the next morning the group left for Pattan, arriving there by 8:30. There had to be no rest or respite from then on. The camp opened at 9 sharp. Doctors treated 700 patients in rural health center and distributed free medicines. In addition, Hazara Welfare donated medicines worth ₹50,000 and 5 water filtration plants to the rural health center Pattan.
बाद जो डिजीज़ पैटर्न था वो वही था जो सीजनल पैटर्न होता है। यहाँ चूँकि पहाड़ी इलाका है तो उसमें स्टेगनेशन ऑफ वाटर, फिर पॉल्यूशन ऑफ वाटर, फिर वाटर बॉर्न डिजीज़ जो होती हैं और एपिडेमिक की कोई सूरत नहीं थी। अलबत्ता ये है कि कम्युनिकेशन डिस्ट्रप्शन हो गया था, हेल्थ फैसिलिटीज़ डैमेज हो गई थी, उस वजह से हमें मेडिकल साइड पे रिलीफ की ज़रूरत थी। तो मैंने ये वाटर फिल्टर प्लांट गाड़ी में अभी देख लिए हैं और मैं ममनून हूँ कि मतलब ये डोनेशन दी गई है और जैसे कि मैंने कहा है एक हम इसी अस्पताल में लगाना चाहते हैं इनमें से, और बाकी 4 के लिए हमारी टीम जगह का मतलब तयन करेगी और वहाँ पे इसका सही इस्तेमाल को यकीनी बनाया जाएगा इंशाअल्लाह। मैं इस टीम का और इस टीम के लिए जो अरेंजमेंट किए इसके पीछे जो डोनर्स हैं उन सब का ममनून हूँ कि डिस्ट्रिक्ट कोहिस्तान जो कि मुल्क का सूबे का दूर दराज और मुश्किल तरीन ज़िला है, यहाँ तक पहुँच गए हैं हमारी खबरगिरी के लिए और ऐन मौका पर हमारी हेल्प के लिए यहाँ मौजूद पाकर मुझे इंतहाई खुशी है। मैं बहुत ममनून हूँ और सबका शुक्रिया अदा करता हूँ।
The camp was wound up by the evening.
We have just finished the free medical camp that was held in Rural Health Center, Pattan, with a team of about 6-7 doctors, opticians and lab technicians. We managed to see about 1,000 patients, and the most of the patients, especially the children, they were suffering from gastrointestinal problems like worms, also respiratory tract infections. I've been told by the lady doctor that the ladies they were suffering from various gynecological problems. In the male side, we saw many patients with chronic diseases like diabetes and hypertension. I was in skin OPD and I saw a lot of scabies patients and also patients suffering from eczema, dermatitis, pyodermas. This camp was successfully held with the cooperation of many organizations, especially Hazara Welfare, and I've just talked to their chief coordinator, Mr. Umar Farooq, and I would like to thank all those partners who have contributed towards sponsoring this camp, especially from the Pakistani population and Pakistani people who are laboring abroad, like in USA and UK, also in Saudi Arabia and Kuwait. I'm also thankful to disaster relief by Irish and Pakistanis, our friends, Pakistani doctors and families from Ireland who sponsored this camp. Similarly, I'm also grateful to Ayub Medical College and their doctors and Disaster Management Center, Abbottabad. This was a collective effort, and we managed to provide relief to many deserving patients, and I'm thankful to all the team members, especially the doctors from Ayub Medical College, our team from Abbottabad Medical Association, our team from Hazara Welfare and hazara.com.pk. I'm hopeful that with the collaboration of many organizations, the partner organizations, we will be able to hold such welfare activities for the population which is affected by many disasters which have happened, which have occurred in Pakistan. So I'm again thankful to all the team members, all the sponsors for their efforts and for their time and their energy. Thank you very much.
The camp was wound up by the evening and the journey back to Mansara began, which was reached by midnight. A lot more still needs to be done. Hazara Welfare has plans. Hope that the others have them too.